What excites me most about the AACN Nursing Essentials is that this is really a transformative process for us. It wasn't a little tweak, it is really a major change in how we look at nursing education. This is focusing on where the graduate needs to be at the time they enter practice. It doesn't start with where we meet them when they come into the College of Nursing, but it's where they need to be as they exit as a practicing nurse. So there are many stakeholders. A few of them are ones that we would automatically assume are stakeholders. Primarily that's our faculty. So we really need to work very closely with our faculty and help them understand what's going to happen with the nursing essentials. But there are many other stakeholders. Our practice partners are a huge group of individuals that we really need to engage with throughout this process. The deans need to work with their institutions, so it's the provosts, it's the chancellors, it's the curriculum committees at the university level, and helping them understand as well what we're trying to accomplish with the essentials. It is admission counselors and advisors, because they're going to be working with students and families. They also are very invested in what does the curriculum look like as they're going through nursing education. Our development officers, they work with our alumni, and alumni are still very engaged and invested in what happens with their alma mater. So being able to help our development officers have a good understanding of what the essentials are and how that's going to impact our curriculum going forward. I think one of the strongest points that AACN is doing is providing those resources that we're all going to be able to use as colleges of nursing. So for example, they have created a group of champions where every institution can identify an individual that meets with AACN regularly and gets kind of the information that they need right at that moment. What's new today is not necessarily going to be new in a few months, and that's because there's so many resources being added every single day. One of those is the Principles for Competency-Based Education, which was developed by a stellar group of individuals across a number of disciplines, and those will be an incredibly useful resource for my colleagues. Nursing has a significant opportunity here to transform what we're doing both in education and in practice. I am very excited about the work that's been done already in terms of moving towards competency-based education, and I'm very excited to engage fellow colleagues across the country in thinking about how do we continue this transformative process and what are the skill sets that we need to have faculty develop as they also engage with us.